So for people with low back pain or hip extension limit, you can work though on the extension limit, but it's critical when you work on the extension limit. If it's not a neuromuscular issue, if it's really tissue tightness and stiffness, make sure you stabilize the other hip. So, or you ask the patient just to hold the leg in hip flexion, maximum flexion, or you can place a belt in the opposite direction to limit the movement. If you don't, as you go in extension, you do a little curve glide, you go on the posterior aspect of the greater trochanter, and you do your curve glide, the patient will feel everything in the back. And we do quite a bit of hip extension mobilization for people with back pain. Make sure you somewhat protect the back by stabilizing the pelvis. As you do your mobilization, you want to target more the anterior capsule and the iliopsoas if you keep the knee extended. You can also look to see if there is a limit of the quadratus femoris in, so it's a little tight here, you know, and then you could also target a little bit the rectus femoris, and then asking the patient to try to straighten your knee, yeah, and relax, and move a little bit more neuromuscular and try to straighten the knee, good, and relax. So make sure you stabilize contralateral leg.